There are some community questions regarding the differences between the flu, cold, and COVID-19 symptoms, and like how do we help to differentiate, and what steps should we take?
Right. So at this time of year in winter, in a typical non-COVID year, we're looking at the flu season, RSV, which is a respiratory virus found in children and also adults. It's popular during winter, sort of come up. And when you combine all of those sick patients with, the bad weather and all the traumas and things like that, with COVID, you get this really crazy mixture of things that happen. But specifically looking at the symptoms for flu versus COVID, it's extremely hard to tell. This week, I've gotten so many messages from people, I have this symptom, my throat's scratchy, I lost my voice, like I do have COVID and things like that. And I just want to read off some of the CDC's most common symptoms with COVID and the flu. And really, it's some of the things we've seen with all of the, with flu and COVID, such as fever, cough, runny nose, headache, sore throat, muscle pain. Some people will lose their appetite, and also loss of taste and smell. So given that list of symptoms, it's really hard to tell between Omicron and the flu. So what I've been telling people is, here are the, based on these symptoms and how they come about, you can kind of tell what's happening, but you should still get tested. So for instance, with the flu, usually the symptoms happen all at once. So someone who catches the flu from somebody else who also has the flu, the next day, the next 24 hours, they might experience a whole bunch of symptoms such as sore throat, cough, congestion, headache, all at once. Whereas somebody with a COVID infection, they might experience symptoms gradually. So about 2 or 3 days after their exposure, they'll usually start to feel a scratchy throat. Then the second day after their symptoms, they'll start to have a sore throat, cough, congestion, and maybe a little bit of a headache. After day 2, then day 3, those symptoms will continue to exacerbate. So that is pretty much what we're seeing with COVID. So kind of just to review, with flu, all the symptoms come on at once. And with COVID, usually the symptoms come on gradually. But again, once you have symptoms and you start asking people, should I get tested or whatever, it's already been a few days. So you might as well just get tested right away. All right, so some final thoughts about flu versus COVID. A lot of the symptoms are overlapping, so I would encourage you to please, if you have symptoms, first of all, quarantine and then get tested to see if you really do have COVID. That way you can make sure that your symptoms are what they are, and then you can do the next steps, which we'll talk about. Another thing that has actually come up is Flurona. I don't know if you guys have heard of that. Or Fluvid or Cove Flu or whatever. But this is something that it sounds funny, but we're starting to see these sorts of cases come in through Europe. And I think there's a few cases in the United States. But basically what happens in general with COVID, when people have, viral infections, sometimes they can also get a bacterial infection like hand in hand. Fluvid is just basically 2 viral infections at once. And so when you have that, your immune system is much more stressed out, not able to fight both things at once, and then both infections become worse at the same time. So that's a situation that you don't really want to find yourself in. And to do that, to avoid that, you want to get both vaccines, your flu vaccine and your COVID vaccine. So we'll talk about it a little bit more later, but that's the last thing I wanted to mention is Flurona is real. But in order to protect yourself from that, get both vaccines.